roti, kapda or makan. These three bare necessities for survival have for long been on India's Aam Aadmi agenda. But one of the most important needs after these basics is also preservation of health. Only 60% of India's population has access to doctors and drugs. For a vast majority of that population, the cost of that healthcare is crippling. India today not only suffers from poor standards of service, but even disparities in those services. The challenge then, perhaps, is not only to cover every citizen, but also to narrow the inequalities in our healthcare coverage. Kiran Mazumdar-Shaw, one of the leading names in India's healthcare sector, has been meeting with the best minds to tap into their rich experience to find solutions to build a national healthcare system. And today, she meets a very special guest.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is Dr. Srinath Reddy, the head of the recently formed Public Health Foundation of India. Over the next 30 minutes, Dr. Srinath Reddy will discuss what the PHFI is going to be doing in terms of developing a roadmap for India's healthcare system. Dr. Srinath Reddy, thank you so much for coming on this very, very interesting program. Let me, start by, sharing with you some of the big challenges which you are very well aware of in addressing our healthcare issues in the country. Let's start with just physical infrastructure, where we know that we need to create 2 million more hospital beds, and we know that it is going to cost us $80 billion over the next 5 years to close this gap. We also know that we are today spending 1% of our GDP on healthcare, whereas we need to really ramp this up to almost above 5% for sure, but closer to 10%. What are some of the things that you are addressing in the Public Health Foundation of India?
Firstly, the Public Health Foundation of India was set up to try and address one major area of deficiency in our health system, that is the lack of public health expertise at various levels. Given that public health is not only dealing with the determinants of health and disease, but also with how the health system must be configured to function in an efficient and equitable manner, the Public Health Foundation's mandate is indeed very wide. Apart from the traditional programs like training people in public health through diplomas, masters and PhD, we are also engaging with health services across the country in a large number of states to try and train existing functionaries in delivering public health much better. So we are actually building capacity at multiple levels and also enabling policy and programs through relevant research, by filling in critical information gaps through research, by evaluating the functioning of programs and trying to suggest where they could have corrections or where they should be scaled up, and also trying to reach out through health communication to the wider mass of the public so that they too can become participants in the healthcare system.
In my various conversations with people who are stakeholders in healthcare, many ideas have been thrown up, one of them being that there needs to be a good role play between the private sector and the public sector. For instance, we know today that 60% of our hospitals are in the private sector, 50% of our hospital beds are in the private sector, and yet we know that we need to create a very affordable healthcare model that is inclusive. And we know that there is a perception that if the private sector gets hold of healthcare, then that affordability factor will be compromised. So, we need to address that. You and I have talked about the fact that there needs to be a good model of, accreditation, accountability, auditing and price, control, to use the crude word. But what are your thoughts on this front?
Well, we must recognize that there is a need to engage constructively all the sectors that are presently now contributing to healthcare in India. So, what we really require is a greater outreach of primary and secondary healthcare services, particularly through a public sector, which has to be more resourceful and responsive to the issues of access and equity. At the same time, we need the private sector, which is present, but which is also mostly urban aggregated, to not only spread out so that it also contributes meaningfully to primary and secondary health care, but also to become more responsible in terms of the cost of health care that it is providing. So, we need an appropriate framework which can draw the contributions from each of these sectors commensurate with their strengths, but also build in a regulatory framework so that quality and access both can be ensured, and of course, affordability becomes a major consideration too.
You know, we know today that our primary and secondary health institutions in the public sector, so to speak, are performing at 30% of their potential, because either they are under-resourced to that extent or they are not equipped to that extent. So, they are in some way not delivering good quality healthcare in any form in terms of what you described. So, one of the suggestions was, can private sector come in and provide those extra resources and then do this on a profit share basis with the government, where the government re-plows back its share of the profit in the healthcare system, so that you can actually make it into a self-sustaining kind of business, and that tertiary care be really left to the private sector, because there we believe that you need to create large health cities that will be able to deliver affordability, largely because of the fact that you have these huge numbers that will bring down costs. Added to this, of course, when we talk about affordability, I think we are also talking about efficiency. So, the use of IT becomes very, very important in driving efficiency into the system. What are your thoughts on that?
Certainly, IT is going to be a very, very important enabler, and we ought to use it appropriately in order to increase the outreach of services. IT is not only to facilitate telehealth or mobile telephony for health, which will enable healthcare providers at the front lines to feedback information to other levels which are more distant, but we also ought to be able to use the information technology much more creatively in order to empower the individuals and the communities, because we must recognize there is a huge asymmetry of information and asymmetry of decision making power in health. In fact, that is one of the reasons why there is a bit of a market failure in health. In fact, it is the supplier who sets the demand for health. Now, if we can actually move the supply also to the people who are actually creating who really are setting the demand, that is the people, give them a lot more health information so that they can actually not only become aware of their clinical conditions and how to prevent them, but also actually do self-care to a substantial extent. But back to your question about private sector participation at various levels. Clearly, the private sector can and should contribute to primary and secondary healthcare services as well. As far as tertiary care is concerned, while the private sector presence is important, I wouldn't leave it entirely to the private sector. You need public sector presence at all levels, including at tertiary care, because you require benchmarking. Benchmarking both for quality and for cost. Clearly, we need standards of care which are applicable both to public and private sector. Now, we therefore require also a regulatory framework for all levels of care. We need clinical guidelines which are set by professional experts, and we need technical audits and social audits. Technical audits to make sure that the management procedures are appropriate and the costs are also need to be contained, and there has to be some cost standardization. At the same time, we ought to ensure that along with this regulatory framework, there are also, and technical audits, there are also social audits to see whether the actual consumer, the individual, the patient and the family are also receiving the kind of care that they desire.
Financial inclusion, or ensuring that every Indian has access to money, has been a mantra for every government. Though micro-health insurance schemes have been plenty, they have been reduced to mere pegs on which election campaigns have been designed. And the fact is that today, only 11% of the Indian population has some form of insurance coverage. The problem is compounded not only due to the lack of proper implementation, but also lack of incentive. So, what can be the solution?
There's another point that I'd like to sort of touch upon is this whole concept of reimbursement, the whole reimbursement model. How do we deal with a insurance system which is a national sort of insurance system, which doesn't get hijacked into state-sponsored insurance systems, which then really don't deliver on what they're supposed to deliver?
Many of these insurance systems as they are currently constructed are like little life jackets or lifeboats being thrown into a river in spate where many people are being washed around and a few people could be rescued, but it doesn't solve the problem. You actually need much sturdier systems. You also require universal health coverage, and that I think is an ethical requirement. It's a right of every citizen, but also targeted programs seldom work efficiently. It's only when it's universal, then everybody has a stake in the system of having to make it succeed. Now, this insurance system would have to be derived substantially from government paid social insurance, to some extent from employer paid insurance, and some people may wish to purchase private insurance as well, or it could be totally tax financed. But whatever be the final mechanism, if there is going to be an insurance system, ideally it must have one single regulator who actually brings in all of these systems into one unified framework again, so that people are not unnecessarily denied. There is no cherry picking, there are no denials of reimbursement claims for frivolous reasons and so on and so forth. Even if you look at other countries, it's very different. In some cases it's totally tax financed, government provided. In some cases it is insurance provided where the government purchases services, but with a proper regulatory framework. In Japan, for example, it's the private sector which provides the services, but government caps the costs and health insurance is compulsory. Now, China has reconfigured its own plan and now has decided that it must provide more than 90% of the population with health insurance coverage. So, we must study the global experience not only in China, but Brazil, Mexico and elsewhere, bring out the best lessons from them and then bring back to ourselves. But universal health coverage, I think, has now become a non-negotiable healthcare requirement.
From your point of view, as the head of the Public Health Foundation of India, is this a key focus for you to really build at least this universal health insurance or health coverage?
Absolutely. I would actually try and extend the concept a little further. I'd like to use the word universal health protection, because universal health coverage is very, very important, and that's a key feature of universal health protection. But even if we were to devise a financing mechanism which will provide every citizen entitlement for a package of services which we believe is absolutely essential, if there is no health workforce to deliver it, if there is no infrastructure to deliver it, if there is no point of access to deliver it, that would remain an entitlement on paper. It's never going to be realized. So, we need to fit all the pieces together. I think we ought to really ensure that financing is properly looked into, health workforce is developed, and is staffing adequately equipped healthcare facilities with substantial spread across the country, so that they are not concentrated in a few states and a few urban areas. That obviously drugs, vaccines and equipment are available at relatively low cost, both for the public system as well as the private system, so that the consumer is not unduly overburdened by having to pay for them directly or indirectly.
Yeah, today 80% of healthcare costs are self-pay.
Absolutely, 80% of the healthcare costs are out-of-pocket expenditure, and for the elderly in particular, the out-of-pocket expenditure is 4 times more than that of people in the working age group. So, these are some of the anomalies that we must really look at. And Thirdly, we must also look at governance issues. The amount of leakage of even available funds through government programs, partly through inefficiency and partly through corruption, that must be set right. Poor management must be set right. The supply chain efficiency must be enhanced. So, unless we fit in all of these elements of the health system together, piecemeal attention to only one element is unlikely to result in adequate health care. So, our foundation's effort is to try and advance universal health care as a combination package, and then trying to say, okay, while we are trying to develop the health workforce, we are also trying to look at health financing issues, we are also trying to look at how management can be improved, and let's try and move the health system on all the four wheels rather than on trying to just race on one wheel.
Dr. Srinath Reddy, a global leader in cardiology, is also a thought leader in driving innovations in public health. And as the president of the Public Health Foundation of India, he has a huge task at hand today to plan for a new healthcare system that will deliver on its promises.
What would be your timeline to deliver on that universal health
I think if we invest sufficient amount of public funding at the moment and optimally utilize whatever is being allocated and bring in the private sector resources into a well-crafted healthcare system which is regulated adequately, I think by 2020 we ought to be able to see substantial improvements, and universal health care coverage should become a reality by then.
That's at least, it still seems a long way ahead, but I think at least if we could start seeing sort of transformational kind of change coming into our healthcare system at least every 5 years, that itself would give us tremendous traction to get there.
Absolutely. I mean, I think looking at the financing mechanism is a possibility which can have in a shorter time frame. By 2015, possibly you might be able to work out mechanisms and build up institutional frameworks for that. But to roll it out and also to correct some of the anomalies in health workforce, like for example, you have I think 38 medical colleges in Karnataka and 8 in Bihar. So how do you correct the anomalies like that? So you ought to be able to provide the health workforce also where it's required to deliver the services that people are now going to be entitled to.
The healthcare sector is a huge job creator. I mean, that also we should realize.
Absolutely.
So I think it has a multiple kind of benefit aspect in terms of not only delivering good healthcare to its people, but also to create jobs, to create new skills. It has a very good positive impact on education. You can also then, of course, leverage all this by addressing your human resource, your needs in like places like Bihar and UP and others, where you know, your ratio of doctors to patients is so poor.
Absolutely, and given the fact that we have a young population and we are going to have a young population for quite some time, at least in terms of the age group between 15 to 59.
Yeah, but at the same time we also have an aging population which is huge in numbers.
Absolutely, the aging population which is growing needs a lot of medical attention, a lot of preventive health care. But given this fairly wide band of a relatively young and productive population who is looking for education, skills, employment, at the same time recognizing the growing healthcare needs of our society, if you can match skill development and employment to healthcare and including preventive and promotive healthcare, then actually we will have a winning combination. Now, it need not be doctor centric. We do require many more doctors. We certainly require even greater number of nurses, but starting from even the second auxiliary nurse midwife, starting from the second Anganwadi worker. Now we have only one Anganwadi worker who has to look at the nutrition of the 0 to 2 age group, looking at non-physician healthcare providers who can be trained as community health workers. Also shifting from, we need specialist physicians, no doubt, but you need to shift some of the functions from specialist physicians to non-specialist physicians, and some from physicians to trained nurses. I mean, elsewhere in the world people are talking about nurse practitioners, nurse anesthetists, public health nurses, nurse obstetricians. So we ought to be able to really expand the other layers of our health workforce while increasing the number of our doctors. So there's a tremendous potential now for rapidly expanding our health workforce with appropriate level of skill development suited to the needs. Primary health care does not require specialist physicians. So, we have to recognize that reality, and if we can do that, then this disparities that exist between urban and rural areas, between different states, many of them can be corrected if not completely eliminated over the next 10 years.
Well, Dr. Srinath Reddy, that was a very interesting conversation, and I really wish you all the very best. I think all of us have to work together to make this happen, because we simply can't ignore the fact that the time has arrived for us to provide universal health protection, as you call it, but more importantly to create a sustainable and an affordable national health system for India. Thank you so much.
Thank you, because India's health and development are integrally linked, and I hope that all of us will recognize the importance of health in accelerating India's development on all fronts.
Thank you.